In this lecture, we will be mainly focused on the humerus. So let's start the humerus. Humerus generally subdivided into three parts is by classification. And this is first I will start from the anatomical position of this bone. So by anatomical position, this bone lie is this in this fish. So the head of this bone directed medially, upward, and backward by anatomical position. The other point that you should remember that the lesser tubercle lie on the interior side. We have a two bump here. Okay, we call this lesser tubercle and greater tubercle. And between the two, we have the space. Okay, a groove in between that passes the tendon of bicep muscle. Okay, so the tendon of bicep muscle enter to this groove to the capsule of the shoulder joint and then attached to the supraglenoid tubercle. So we will not go into detail of this, but this is intracapsular because it entered in the capsule of the shoulder joint, but extrasynovial. It is not entered to the synovial cavity. Is by classification, this is one of the long bone. Okay, in the upper limb, this is one of the longest and strongest. So is similarly is other long bone. It's divided into three parts. We have the proximal end. This is round in shape, and this articulate with the glenoid cavity of scapula to form shoulder joint. So this part and this upper part, we call this proximal end. And we have a distal end that flattens side to side. And between the two proximal end and distal end, this is shaft of the humerus. And we will be discussing in this intervening part or body of the humerus, the border and surfaces in more detail. So let's start from the first part, proximal part of the humerus. What we have. Okay, so it starts from the round head of the humerus. This is the head of the humerus, which articulate with the glenoid cavity, and the head separated by a very narrow line from the rest of the structure. We call this anatomical neck, the surrounding. So this is head, and we have a narrow line that surrounding and separate the head from the rest of the humerus. We call this anatomical neck. After anatomical neck, you will see by anatomical position a two bump, one on the interior side and one on the lateral side. And between the two bump, we have a sulcus, a depression, which accommodate the which allow passing of the bicep tendon. So bicep tendon enter to the sulcus and then enter to the capsule of the shoulder joint and then attach to the supraglenoid tubercle. Okay. Other thing we have here, again it narrow over here after greater tubercle and lesser tubercle. When you pay attention on this part, so it again narrow, and we call this surgical neck of the humerus. And we have a third neck also, which is called morphological neck. So this morphological neck corresponding to the growth plate of the humerus. When we mainly look at the lower end of the humerus, when you look at the lower end of the humerus, so it is subdivided into articular part and non-articular part. The articular part includes the capitulum and trochlea, because this part articulate with the radius and ulna to form elbow joint. When you look at the capitulum, so capitus means small head. That's why they name so, because it looks like a small head, and it articulates with the radial head to form elbow joint. And on the other side, when you look at the trochlea, so it looks like fully in shape. So these two includes in the articular part. Then on the other hand, we have non-articular part, which includes the medial epicondyle and lateral epicondyle. And beside this lateral and medial epicondyle, we have two fossa over here. This also includes in the non-articular part. When I flip on the other side, so you will see the trochlea and the capitulum again, and a big fossa. This is olecranon fossa that accommodate the olecranon during full flexion of the hand. Talking about this radial fossa, it located a little about the capitulum, and it accommodates the radial head during flexion of hand. Okay, during flexion of hand, the radial head comes to this fossa and fix over here. Then we have the coronoid fossa, give space during flexion of hand to the coronoid process. Now let's come to the border and surface in this intervening part. This is body, and in the body we have three surfaces and three borders. We have a interior border, start from the lateral lip of the bicipital groove. Here, this is lateral lip of the bicipital groove, and run on the interior while running in the middle, it formed the medial boundary of the deltoid tuberosity. Then here you can see this is become round inch. Then the shaft, if you see, it divided into upper cylindrical part, and the lower part is triangular in shape when you make cross section of it. So this is the interior border. Start from the lateral of the bicipital groove, run on the interior aspect of the humerus, and this border divided the interior aspect into two surfaces. One on the medial side, which we call anteromedial surface, and we have introlateral surface. Half of the surface lie on the interior side, and half of the surface lie on the lateral side. Then we have lateral border. Lateral border start from the supracondylar ridge. So we have on both sides, we have medial supracondylar ridge and we have the lateral supracondylar ridge. So the lateral border start from here, and this is well defined over here. But is it reached to the spiral groove or radial groove? So it terminated, cut by the radial groove and disappear. And again from here it appear and reach to the proximal part. So now we have the medial border. So medial border start from the medial supracondylar line, okay, and move on the medial aspect and join with the medial lip of the bicipital groove. So now we have a posterior surface also that lie between lateral border and medial border.